So on the slide where it says the procedure, we're going to kind of walk down through that one a little bit. Verify the order. Make sure that you know that this is the right patient, that you're supposed to be doing this AccuCheck or this blood glucose check at this time. Introduce yourself. Identify the client with 2 identifiers. You can ask them their name. It's not a good idea to say, "Are you Sally Jones?" To ask them to verify their name. Ask them, "Can you tell me your name, please?" Because some patients, if they're confused, they just want to make you happy. They just want to be your friend. So you can ask them, "Are you Sally Jones?" And it can be Mary Smith, and she'll say, "Yes." Just because she's confused, she doesn't understand the importance of her answer, and she just wants to be in agreement with you. So ask them, "Can you tell me your name, please?" And then the second identifier, you can ask them for their birth date. You can verify their medical record number that's on their chart, that's on their armband. With a baby, you can check there's a number on their cord clamp, and you can use that as a second identifier. One thing that you never want to use as a second identifier is the room number, because our little confused Mary Jones may have wandered into Sally Smith's room. That doesn't mean that she's Sally Smith, okay? Don't use the room number as an identifier, because people wander around sometimes. In order to prepare the patient, first you want to explain to them what you're going to do, why you're going to do it. If they have any questions, any concerns, if they say, "I don't get that done," go check your order again, check your patient again. This might be Mary J. Jones instead of Mary S. Jones. It might be something you're missing in there. If they say, "Not me," verify what you're doing and make sure that you're doing the right thing. Don't ever just blow them off and says, "Well, the physician said you're going to do it now." Bad plan. It'll lead to errors sometime in your career. Another way that you're going to prepare the client and the environment is you're going to, like I said, make sure that they wash their hands, make sure they understand what's going on. If their hands are cold, you're not going to get as good a sample. You're going to have a really hard time getting it. So you want to make sure that their hands are warm to touch. If they're not, you can run some warm water over them, or you can hold their hand in yours for a little while and get some blood flow in there, get a good capillary blood flow system going. If you don't, you're not going to be able to get it. Wash your hands. Get gloves on. Remember, you're about to draw blood on a patient. You do not want to be touching their blood. Standard precautions. Everybody has something infectious unless you can prove otherwise. So always wear your gloves if you know you're going to be drawing blood. Warm it up. Check their hand, make sure that it's warm. Even though you just had the patient wash their hands, you're still going to cleanse it with alcohol, because you want to make sure that the bacteria is off and allow it to dry, because if you take that lancet through the alcohol and it's not dry, it'll burn. It'll hurt them a little bit. We don't want to do that. In a lot of facilities now, your patient identifier, you have a scanner, and you scan the patient's armband to identify them. Once you've got their finger clean, you're identified, you put the lancet against the side of the finger and push the little device, get the blood. Always want to wipe away the first drop. Just because there may be some debris in there, might be some serous fluid in there, it may not be just blood, and you want just blood. So wipe away the first drop, and then the second drop, obtain your specimen, get it onto the strip. Insert your strip into the monitor, unless it's one of the ones that you have to have the strip in and then collect the blood. Nurses have to be flexible. You have to know how your equipment works. I can tell you something based on the machine that I'm thinking about, and it's not the way that you're really supposed to be doing it. The principles are the same. You want to make sure the patient's identified. You want to make sure that it's clean. You want to make sure that it's a good drop of blood. But as far as the exact steps of when you apply the blood and how you apply, if it's on the top or it's on the end, that's all going to be related to your machine. So you're going to have to know how to work the machine that you're working. But once you have the strip, the blood on the strip, and it's in the monitor, want to make sure you discard your lancet. In fact, a lot of times I'll do that before I do anything else. While it's in my hand, I'm going to get rid of it. Once you've got the blood, you want to put the 2x2 over the site so it doesn't continue to bleed while you finish checking the blood glucose. Take off your gloves, wash your hands, wipe off the equipment. It's important to wipe off that equipment between each patient so that you're not carrying bacteria from one place to the other. And then document your reading in the electronic medical record or in the chart. Always want to make sure that you document as close to the event as you can so that nothing's missed, nothing's forgotten, nothing's confused with somebody else. The things that you want to document are the time, the site, where did you get it? That way if they wind up an infection or something, well, that wasn't where I stuck them. what the results were, whether or not the patient had any difficulty, if it continued to bleed or if the bleeding stopped immediately. I'm really not a big fan of patient tolerated the procedure. I think that that'll get you in court someday. Any observations, anything that you think is pertinent, and any comments that the patient's made, any follow-up. If their blood glucose is outside of normal range, either too high or too low, what did you do about it? You need to, if you don't document it, you didn't do it. So make sure that you document what you did with your results. The most common place to draw blood for a capillary glucose reading is the fingertip, usually on the side. You don't want to go on a calloused area, it's harder to get it, so usually you're going to kind of go on the side a little bit. You can also do it on the earlobe, and on a baby, you're going to wipe off and draw the capillary glucose from the heel. If the area is already bruised, if it's cyanotic, if there's scarring, if it's calloused, don't go there. You're not going to get an accurate reading. It's going to be difficult to get, and it's not going to work well. Usually they prefer the middle two fingers, the ring finger and the middle finger. However, if they're getting it every 4 hours, it's not going to be very long before those areas are all bruised, calloused, bleeding red, whatever. You're going to have to move over to some of the other fingers if you're going to get a good sight. And use the side of the finger. Like I said, it's better than the tip. However, I've had patients who insisted that you do it on the calloused area. Don't stand there and argue with them. Patient's always right. If they want you to do it, do it. It's just going to be harder. But that's not your gold standard areas. Depending upon your patient, some of them have been having this done for years. They don't even feel it anymore. It's old hat. It doesn't bother them a bit. Others, this is new for them. Some of them, it'll create a lot of anxiety. So make sure that you give them emotional support. Make sure that you explain to them. With children, make sure that the parents are there. Make sure that the parents are going to be able to comfort that child. Know what your policies and procedures are, because that's always what you're going to be held to. If you do something outside of policy and procedure, it's now on you. So you want to make sure that you do things the way they need to be done, the way they're laid out for you to do. Know what the reference ranges are. Know where that blood sugar is intended to be and what you need to treat for. Be aware that any deviation from normal values may occur as a result of medications, dietary changes, illness, fever, anxiety. All those can cause changes to the blood glucose levels. So make sure that you take all that into consideration. It's part of critical thinking. You have to think about everything as a nurse. So consider what may be causative factors. You know, when did they eat last? What did they have to eat? Have they been snacking? Are they under stress? Is their disease process getting worse? After you get the blood sample, you're going to have to dock your meter in order for it to upload into the system if you're at a hospital and it's being downloaded into the EMR. Some of it will go directly on, but if you don't download it every now and again, it's not going to recharge and it's not going to complete downloading the rest of the information. You also have to do high and low testing every 24 hours. That's usually done on the night shift, but if it needs tested, you're going to have to learn how to do that. And it's just use the test solutions instead of blood. Other than that, there's really not a whole lot of difference. You still do want to wear gloves. Nursing diagnoses that can be related to this: anxiety related to the procedure, risk for impaired skin integrity because you just made a hole, disturbed sensory perception related to the disease process. A lot of diabetics wind up with neuropathy, which is a chronic numbness and tingling, almost electrical burning in their fingers and feet. Your goals for outcomes is that your blood glucose is within normal range, that they are able, the caregiver or the patient's able to demonstrate how to correctly and accurately obtain that blood glucose specimen and do the procedure, that they verbalize understanding of the need to monitor their blood glucose. If a patient doesn't understand why they're doing something and the value of it, they're not going to continue to do it. And you want to make sure that your puncture site, you did just make a hole in the integument, so you do want to make sure that they remain free from infection and that the client expresses that they're not as anxious about the procedure, that they're becoming more accustomed to it. Evaluation, you're going to inspect the puncture site, compare the glucose readings to previous ones. What's the normal range for this patient? We know what the normal values on average are 70 to 120. That's what you're looking for. 70 to 120 is your range that you're expecting. But that might not be where this patient lives. If this patient is just beginning to learn to control their glucose and they're used to living in the 200s, 250s, 300s, and now their blood sugar is 70, they may be feeling fairly bad. They may be feeling like their blood sugar is too low. So you need to know what's going on with them and kind of work their ranges down to a more normal level over time. Compare their reading levels to normal values. Ask them to state the importance of normal values. What's normal for you and why do you try to keep it that way? And you may need to be adjusting what normal is for them. They may have been running 200s, 300s. That is not good for their vessels. Glucose molecules are big and they will tear up vessels. They will cause kidney problems. They will cause eye problems. They will cause circulatory problems. They will poor wound healing. So it's important that they learn to keep those values in a lower range, but sometimes you have to kind of wean them off and wean them down and let their body adjust to those lower levels. Some patients at 60 may feel symptoms and need interventions. Orange juice, candy, if they have a reading that's 126 for 2 more times, sometimes physicians will need to follow that up and see if they're beginning to have a problem. They may need to begin to screen them for diabetes. Future is here. They have got incredible devices that are coming out that will monitor their blood sugar, and it looks like a watch. And I've got a photo of it for you here, and there's websites on md.com and diabetes.org. Will kind of keep you up to date on some of the newest things that are coming out, because when I was becoming a nurse, there was no cure for diabetes, but they've got some medications out now that are beginning to show promise. There's some potential going on there. So research is great. I know it's time consuming, but it's important for you to stay on top of what's new and what's going on in the field, because medication changes. The nursing field changes. The possibilities change, and we need to stay on top of that. They have a continuous device now that continuously measures the glucose and sends it wirelessly to the patient, to the physician, whatever. So keep up to date on the trends. There's a lot of exciting things happening here, because diabetes is a very difficult, dangerous disease process. It can lead to a lot of complications and a lot of other symptoms. So it's something that there's always a lot of research going on with, and you want to keep up on that. Teaching opportunities that you have with this is stress the importance of monitoring their blood glucose at home, help them to locate resources with information on where to obtain testing supplies, teach them how to correctly dispose of their sharps in a non-permeable, puncture-resistant container so that no one else gets hurt, and refer them to their community diabetes support group, because that is something that they're going to need some help with. All right. We are now, when we meet again, going to work on learning how to check your glucose, and so that you can do that in clinical as well after you've checked out on it here. So make sure you understand what to do, how to do it, and I'll see you in class.